Ketamine is a really fascinating drug, of course. It's one of the most potent NMDA receptor antagonists, but the pharmacology is actually very diverse. It hits multiple receptors. In fact, it hits opioid receptors as well, AMPA receptors. So it really is almost designed as the perfect short-term acute phase anesthetic. And we know this because in the Vietnam War, they started using this instead of the medics running out and giving people high-dose opioid and then people coming back in respiratory distress or even dead from the opioid that they got, the shot of morphine that they got in the field. They started using ketamine plus a little bit of morphine. And they found that it was a very much safer drug. It also proved to be a much better anesthetic. The interesting thing about using it on the battlefield is that it is twice as strong as, twice as good an analgesic as opioid, but it also causes amnesia of the same sort of as midazolam. People don't remember the experience, which is a good thing. I mean, if you're all shot up on the battlefield and the first person to you gives you the shot of ketamine, it's a great thing that they have amnesia. But also, interestingly, the opioid lowers respiration and heart rate and blood pressure, so it can be a big problem in people that are already shot and losing blood volume. Ketamine raises blood pressure and actually causes bronchodilation. So the role of ketamine in pain shows great promise. The bad news is we have very little research. Everything is anecdote now. Doctors are just spiraling off and using whatever, whenever, however they want to, because there's really no protocol, no guideline. Until recently, we had done survey work and consensus work, and we published that. So hopefully that'll provide sort of a framework for people to start, of course, A, practicing, but B, doing better research. It really holds great promise, but unfortunately, we've gone through several permutations of how to use it in specific diseases like complex regional pain syndrome. Anecdotally it works. Certainly patients tell me it works. There's Lazarus stories of going in and they can't move and can't get out of bed and they get their 2 or 3 day coma from ketamine and they walk out carrying their bed, Lazarus-like Lazarus-like stories. But also the first 98 people that were given the ketamine coma approach, in other words, very high dose, one died and one was paralyzed. So that's, of course, an unacceptable risk-benefit ratio. So what we've determined is that it's probably better to use lower doses. What dose? Again, it's driven by anecdote. It's all over the place. But everybody pretty much says that you have to get to the point where you're seeing little pink elephants on the wall. In other words, beginning to have visual hallucination for it to be effective as an analgesic for chronic condition. Which brings us to the point today. What about this drug, which holds, I think, significant promise, driven by protocol and good research for analgesia? This was an interesting question because when you ask patients, the data that I could find, the qualitative data I could find, the patients were all over the place. They all had a different reason for abusing the drug, almost as different as the protocols that doctors were using. But we do have actually some solid retrospective scientific data coming out of Hong Kong, interestingly. Apparently, ketamine, or as they call it, Special K, was a drug of significant abuse in these dance parties. And people got into very high dose, and they used it very frequently. And from that, we get interesting information about what are the acute toxicity effects, what are the effects that the people are apparently using it for. Of course, if they got the effect and not side effects, they didn't end up in the emergency room, and that's the data that we have. But we've begun to put together an idea of what are the consequences of high dose and prolonged use. Aside from the acute effects, the hallucinations, delusions, paranoia, etc., there do appear to be some long-term side effects from high-dose use. And that would be specifically bladder and urinary tract problems, and potentially long-term problems, sometimes leading to dialysis, according to the Hong Kong literature.